Hi there.
Hello, how are you?
I'm good, thank you. You well?
I'm good, thank you.
Excellent. Good.
Thank you for joining me. I appreciate your time.
No, not at all. It's a pleasure. It's
Yeah.
always good to speak to people, interested in the same things and wanting to get ahead with what we're doing. It's a pleasure. Thank you for inviting me.
Yeah, thank you. So we're going to share this with 85,000 cosmetologists just in our database and hopefully more. So, spreading the awareness to them with the hair loss industry and what they can choose to help with their clients is going to be so valuable.
Okay, great.
Yeah.
Good. Sounds good. Thank you very much.
Yeah. So, I mean, we can start whenever you're ready.
Yeah. Rennick, before we get going, or actually when we get going, I'd like to ask you a question, if I may.
Yeah, absolutely.
And it would be about your hair loss journey or your hair journey, and also why you're doing this. And that's what I'd like to know.
Yeah, so I'm doing this because I actually operate a hair replacement clinic now,
Mhm.
and I've been doing it for 23 years. And I just actually the work found me. I knew I was working in a salon, and I knew that there was something more that I should be doing. And it was three people removed. And I went to work at a hair replacement studio. And I just fell in love with the work. It was mostly men at the time because it was 23 years ago.
Mhm.
And they did low level light therapy, PRP treatments, things like that that had just started. And it just felt like that was my calling and just working with people. And then as the years went on, it was more women started to come in. And even though we were treating or helping to try and treat their hair loss and even encourage new growth if we could with supplements and the low laser light therapy and scalp treatments, it just didn't always work. And I did end up going out on my own and purchasing a hair replacement clinic because I felt like we needed more of a natural approach for some people because some people couldn't even afford the medical side of it, the PRP or the transplants and things like that. So then, I just started to focus on women and men and children. And so I currently work with alopecia patients, trichotillomania patients, cancer patients, scalp traumas, people who have had scalp um, surgeries and things like that. And there's just a missing link between our community and the beauty industry. And unfortunately, I'm always everyone's last resort because I do the hair pieces and more of the hair integrations. And so I'm everyone's last resort. Nobody wants to wear hair and things like that. But I even during my journey of working with people, I had a couple children and then I also got diagnosed with a couple autoimmune issues. And I was like, I didn't look like myself. I didn't feel like myself. I knew I didn't look that great, as great as I used to. And so I'm like, why am I not my own client? So I actually started wearing a hairpiece and I mean it's life-changing. I just feel so much better about myself. I look better, and even on days when I don't feel well, I still look well. So that really just launched my passion into working with women and children that needed my services. And so we do that. We donate hair pieces to people that can't afford it and don't have coverage. And so really, this brought me to this point of trying to make that connection between the beauty industry and the hair loss industry, and hopefully giving people the tools that they can help their clients so they can keep them in their chair and that relationship going and growing and um, help close that gap.
Okay, thank you. It's amazing how many people we meet who are brought into this by personal experience of one kind or another. And I think everybody I meet has some passion for what they do in this industry, which is so lovely.
Yeah.
And as it is the patient outcome, it is the client outcome that's the important thing at the end of the day. So yeah, thank you.
Yeah, you're welcome. In a nutshell, that was probably a lot longer winded than what you were hoping for.
Not at all, no. Thank you. Right, I'll to introduce myself, my name's Neil Harvey. I am the current chair for the Institute of Trichologists, which is a learning, an educational body in the UK. We've been set up since 1902, so we've been going for a few years now. We have lots of students on our course currently. We're working really hard to upgrade our education department, and we have done. We have upgraded it tremendously. We're working really hard in our own clinics to help people with hair loss issues, and we're working really hard to get the message out there about hair loss and to people who need to hear it. So that's who I am. I've got a great job because I get to hang out with some really great people all the time. I work with a board of directors. They're all very, very motivated. They're all fascinating people to talk to. And we have 160, I think, registrants. So 160 people who are Institute of Trichologists here in the UK and abroad as well in other countries. So we've got some in the States. We've got a trichologist I met the other day who's in New York. So we're sort of spreading throughout the world. So,
and that led me to a question: is you do teach abroad so people can join your facility online?
Yes, we do a lot of education now, particularly and obviously since 2020, which online and the online element has grown massively. They will still need to come to the UK to see us to complete the whole of our education. So whereas years ago somebody might have had to have travelled to us much more, they don't need to do that as much. But to end up with our nominal letters after their name, to end up with our qualification, they will have to come to the UK a few times throughout the year.
Okay.
And I was fortunate enough to sit in with a room of international students recently, and what we'd done for them, their actual hands-on clinical training, we'd done it as a block, so they came for so many days rather than flying into the country to and fro. They came for so many days and did it all in one go until the next time. To check that out, you need to speak to our education department, but that's my understanding anyway of what we're doing. So yes, okay. We are educating abroad as well.
That's fantastic. Can you share some of your knowledge on why you think hair loss happens, and if there's things that we can do to prevent it?
Well, certainly. Some of the why it happens. First of all, a lot of what we're seeing is still androgenetic hair loss. So based around androgens, the male hormone element. But it can be triggered by lots of things. So a lot of preventative issues would be lifestyle management, exercise, sleep, diet, just generally being healthy, all the things we know about, but we don't do because we're tempted to do all the bad things a bit more, and we're tempted to slip into bad habits. So that's certainly going to play a large part of avoiding hair loss or minimizing hair loss to begin with. Over and above that, seeking help and advice and diagnosis fairly early on, quite quickly, so that whatever treatment plan can be devised for that individual person and their hair loss issues, we can get going with that. It's far easier to try and minimize hair loss than it is to lose it and try and make it grow back. There are inherent problems with that, depending on the person and what's causing the loss. So general health, good choices, seek help quickly. Those are the top, if you like, bits of advice I could offer anyone, anywhere.
We see a lot of women with the androgenic alopecia. That seems to be one of the top diagnoses lately in my facility. How would you suggest they find that out earlier? I mean, are there signs or to get ahead of it?
Only when you say it, it seems obvious, but perhaps when you're busy and you're running around doing everything you need to be doing, maybe you don't notice for quite a long time. So an increase in hairs on the pillow, an increase in hairs on your shoulder and in your car, in the shower when you've had a shower, seeing a little bit more scalp when you look through into the mirror, in the bathroom mirror. In my bathroom, I've got one of those mirrors you get to see the back of your head. I'm not really sure it's a good idea, but I often have when I'm in there, the light shining on the top of your head, and you tend to sort of see the scalp through it a little bit. So all of those things, which, as I said, when you say it, sounds a little bit too obvious, but maybe we don't pay attention to them soon enough. And maybe, obviously, just for 1 or 2 days, that's not really an issue. But if it's going into week 2, week 3, week 4, then it's going to start building up. It's going to start to be noticeable. And yeah, you need to go and seek some advice. The greatest advice that you want to hear is you've wasted your time seeking advice. You're fine. Don't worry about it. But that's great. That's good news. But diagnosis is always the key. Try and find out as soon as possible what the causative factor is and what can be done about it.
And would you think that would be a blood test? Like, are there certain markers that would be a blood test, or just visual?
Everything. So certainly visual is very important. Hairs, as we said, on the pillow, hairs on your shoulder, more scalp, very important to notice. Blood tests are great. There are markers in blood tests that we can find, we can look at, particularly as practitioners in hair health, as trichologists. We look at things a little differently than other medical practitioners. So quite often a reading for something is perfectly fine for general health. You're alive, you're kicking, you're doing your thing, that's fine. This is good for being alive, but it's not good for hair health. It's too low a figure. We need to build that up. Again, some people are rather disappointed when they have blood tests and they find out that there's nothing we can pinpoint. And, oh, they're all great. These blood tests are telling us that you're a really healthy person. That's a good thing. At least we can look beyond that and start to look at other things, look at through the family line, look at siblings, look at parents, look at stress, anxiety, look at upsetting incidences, illness, medications. We can start ticking the list, but it's a big list to look at.
It is. Would you recommend a trichologist over a dermatologist if a dermatologist doesn't find something?
Possibly. The dermatologists I know are all great, and I really respect the profession of dermatology without a shadow of a doubt. However, many of them that I know would agree with this point. is that dermatology is principally the study of skin. Hair grows out of the skin. So they tend to do some training, they have knowledge on hair. But if I was talking to a patient and advising them, and they weren't here and I couldn't send them to a dermatologist I knew personally, it would be to look out for a dermatologist that has a special interest in hair. Someone with a lot of experience, someone with patience, someone that sometimes even just runs a clinic to do with hair loss. And they look at it differently than a dermatologist for skin, who, as I said, they're great. I love them. They're all wonderful. And we love working with them. And I have full respect. But a dermatologist with a special interest in hair, it's got to be every time.
Right. Does a trichologist use a scope for the scalp?
Yeah, there's very similar. Well, there's lots of different ones, but we have ones that are similar to dermatologists when they're looking closely at the skin, at moles and things like that. So each trichologist will have their favorite ones, whether it's just one or two or three different ones. So in my clinic, when I'm seeing patients, I've got two that I love. One of them records the detail of the scalp, the follicles, the hair, the numbers of hair, diameter of hair, the list goes on and on and on. And it feeds it all and it gives us these statistics and feedback. So we've got something really good to look at and base our diagnosis on, but also something great to look at in comparison 6 months later, or 3 months later, or 9 months later. And then I've got another one that I literally just attach to my phone, and I can take photographs of and enlarge them, and it gives me a snapshot of that little area, whether it's just on the temple or the hairline, and I can store those then and come back to them. So I've got two that I use. I have a colleague that has a whole collection. They've got like a museum of state-of-the-art scopes and old ones, and they use different ones for different things. It's part of our exciting toolkit. We love scopes.
Right. So if somebody was just in the early stages of hair loss, what would you recommend or to try? So, like supplements or increasing water?
I often see on social medias, so I'm connected to lots of different pages, lots of different health ones, and also hairdressing ones. And sometimes someone, a hairdresser, will put up a post saying, "My client's got thinning hair, what would you recommend?" And within a minute, there's 100 different recommendations. Drink water, take supplements, rub olive oil on your scalp, do this, do that, take hot baths, do all sorts of things. And you read these and you think, having 100 recommendations is no help whatsoever. You don't know which one to turn to, what to do. And you're always going to come across someone that has a really weird and wonderful thing that they did that definitely made their hair grow back. And they're sure it's not coincidental. So supplements are a little bit like that. And that's why blood tests come into it. If your blood test is telling you that you are low in ferritin, in stored iron, you're low in iron, i.e. you're anemic, you didn't realize it, but it explains why you're tired, why your skin's not glowing all the time, etc. Then you take iron supplements, or you change your diet, or both. And that's the thing about supplements. It needs to be targeted. We need to try and find out what, if anything, someone is deficient in or needs to build up, and then prescribe, give to that person that supplement. It's no good just running off to the shop and buying a whole load. You could be taking them for a year or more, or 2 years, or 10 years, and they might not be doing anything for you. They might just be coming straight through the other end and of no benefit at all. So that, again, that's the whole idea of pinpointing and targeting. What is the cause? What is it? It could be not just one thing, it could be 2 or 3. Sometimes we meet people that have multiple things all coming to them at once. So base our recommendations on what we find out during consultation and diagnosis.
Do you happen to have an example of someone who had multiple things wrong that they needed to increase their intake on? Like you had mentioned iron.
Yeah, absolutely. Yes, we've seen patients where we've looked at the scalp, we've diagnosed what's happening via clinical observation, and we can see signs of androgenetic alopecia, female pattern hair loss. We see it running through the family. So we think, right, we need to start doing this. We need to use maybe a topical solution to massage into the scalp to address that problem. However, I'm also seeing a lot of shedding and a lot of short, fine hair. So we've got an interruption in the growth cycle. What's causing that? Let's have a look at your blood tests. How long have you been anemic for? What does anemia mean? What does anemic mean? I didn't know that. So we're looking at supplements. By the way, let's have a look at your diet. We think we can alter that. Let's have a look at your lifestyle. We think we can alter that. The list could go on and on and on. But we do find people with, as I said, androgenetic alopecia, telogen effluvium, and anemia. 3 things all combined. Maybe even a 4th one. They're a woman in their 50s. They've just hit menopause. They've just come through the perimenopause. So now they've got 4 things going on. So they've got to make a number of adjustments in their life to address each one, to take each causative factor away and give them the best fighting chance of maintaining that hair.
Right. So when you said topicals, do you think, and I know that there are special topicals for those situations, do you think there's a certain shampoo or a product that you should avoid? I see a lot of things about sulfates and parabens. How do those play a role, if at all?
My only really concern with either sulfates or parabens is if you actually have an allergy to them. So if they're causing you some itchiness, some flakiness on the scalp, then yeah, by all means, avoid them. One of us could be allergic to peanuts. The other one loves them all day long, eats as many as they can get. What's good for one person isn't always good for another, and vice versa. What's bad for one person. I think sulfates and parabens are getting a very bad press. They've been picked on. They're the demons, the bad boys in shampoo. Do they cause hair loss? I haven't seen any evidence at all yet to say that they cause hair loss or should be avoided if you've got hair loss issues. I've read articles that have suggested it, and I've read people's opinions that are very definite down on that side of things, but for me, not at this moment. Not at this moment in time, no.
So mostly it seems like it's internal or genetic.
Yes. I think it's very important for talking about shampoos, to shampoo often. One of the first things that people tend to do, that when I speak to someone in my clinic, I've noticed more hair coming out when I'm showering. So I'll stop washing it. So, no, don't do that. It's one of the worst things. Keep the scalp healthy, keep it clean, keep it activated, massage the scalp. It's not the shampooing that's making it come out. It's going to come out anyway, if that's what's happening. If you haven't washed it for a week, you'll have 4 times more come out than if you'd have washed it every other day, and a certain amount had come out every other day. It won't help. But a dermatological base shampoo, something that's going to be kind, something that's going to be good for the scalp. Shampoos are meant for the scalp, not the hair so much. when you're rinsing it and it's rinsing through your hair, that will clean. But if you think about it, we're massaging the scalp, we're cleansing the scalp, we're taking excess sebum and oils, and to some degree, maybe even excessive bacterial buildup away from the scalp biome and the scalp environment. We want it to be nice and clean. We want the follicles to be not plugged. We want them to be clean in order for hair to grow. So although shampooing and having a good shampoo doesn't stop hair loss, it's one of the important first steps to keep the scalp healthy, to encourage and help hair growth. There's no simple answer, is there? There's always a longer bit to the answer, I'm afraid.
I mean, it all just sounds like it's based on an individual situation, but how often should the typical person shampoo their hair?
I wash my hair every day, but I'm a guy, and guys, I think, tend to do that more. You know, we're in the shower, we've got shorter hair. It doesn't take us an hour to blow dry and style it. We just get on with our day. So it's nice and easy for us. For women, I would say it is personal to each one. Something like every 2 to 3 days. I get a bit worried if it goes longer than 3 days. Obviously, if someone's got oily hair, oily scalp, if they're producing more sebum than someone else, then maybe you should be washing it every day, or at least every other day. If someone's got very dry skin, dry scalp, again, washing away the buildup on the surface is still going to be good for them. So it is individual, but there are extremes where if you're doing it 10 times a day, that's too much. If you're doing it once a fortnight, no, that's not enough. We need to get the healthy balance.
Right. Have you seen anything about the oil rinsing, where or referring to oil cleansing? I've seen some cases where people are recommending you oil will cleanse oil, and some people are not even using shampoo. They're just rinsing their hair or using the oil of their own scalp to cleanse. And from what I've read, there's a period of time, about 3 months, where your body adjusts from the regular shampoos and almost like detoxifying from everyday shampoos. So obviously there's a level of odor that you have to get through, but I've seen articles lately where they're suggesting maybe oil rinsing or just rinsing your hair is helpful. Have you seen that?
It's been something 3, 4, 5, maybe longer than that I first noticed that coming out online, articles suggesting this. It's not something we would recommend. I certainly wouldn't recommend it in my clinic. I like to see the scalp. When people come in and we get the scope on and we're looking really intently, closely at the scalp and the follicles, and we see build up on there, we see plugged follicles, we see hair struggling to kind of break through there and to grow. We're not seeing a healthy environment as we know it for hair growth. So I would prefer regular and thorough as well, thorough cleansing, massaging the whole scalp behind the ears, back of the neck, the hairline at the front, leaving the lava on for 3 minutes or something before rinsing. I haven't seen problems caused by doing that. I've only seen problems caused by not shampooing enough. Seborrheic dermatitis is something that we get a lot as a secondary condition diagnosed when we examine the trichoscopes of the scalp. And I often have to warn people. I say, look, when this report comes through, it's going to probably mention this thing called seborrheic dermatitis. Don't worry too much about it. We can easily fix this. And it's I'm seeing signs of it, but it's very light. Don't worry. We try and play it down. But if it gets worse, it could develop into something else. So yeah,
Yeah.
clean is good.
Right. I guess that's something, because I don't do that, but it's something that I didn't even think about, which makes a lot of sense. Just clogging your pores and clogging your scalp.
Yeah. Can you imagine not washing your face? Okay, you're not going to wash your face for 2 weeks. Of course you are. You're going to run off to the bathroom and hide and wash your face and cleanse it. You're not going to go for 2 weeks without washing your face. Similar thing, except up here, there's more chance for oil, for sebum to become trapped because we've got all this hair here holding it in there, and it's warm and it's a good environment for bacteria to breed and grow. We've all got bacteria on our skin, of course we have, and we need it. We don't want to get rid of it completely, but we want a healthy balance. We don't want it to overpopulate. So
Right.
again, for me, until I read something different, clean is good.
Okay. So going to the hair washing, have you seen anything in regards to letting your hair air dry? And I'll expand on that. Coincidentally, when I see people who come in with alopecia areata or, um, you know, alopecia in general, and this is a coincidence, they've all let their hair air dry. So I questioned, was it a buildup of bacteria that could have possibly let their hair fall out in addition to autoimmune issues? Or it was just a very common thing in my own facility that I recognized.
I no, I haven't heard of that one at all. I'm going to start asking the question then. It is a question when we send forms out for people to fill in before the actual consultation. This is what I do. It is on there about, do you blow dry your hair? Do you leave it to dry naturally? I'll go back and check them all, but it's not a pattern that I've seen. And for the life of me, I can't picture the two things coming together. Why one would be a cause? It's not usually something that we've ever highlighted before, that not blow drying your hair could be an issue. But I'll look out for it.
Yeah, I just found it really interesting. Could have been bacteria or excess anything. There's a lot of yeast people are talking about, and just really a fascinating, even hairdressers that are seeing people in their chair that have alopecia. That's usually my first question for them. Is your client air drying their hair or going to bed with their hair wet? And they usually have a dense head of hair, and almost 9 times out of 10, their answer is yes to me, which I found interesting. But again, all coincidence. But just was throwing that out there.
Okay, and that's kind of like a diffuse thinning as opposed to round patches of loss.
No, some of them were more alopecia areata,
Okay.
which was interesting. All in
Yeah,
the
we always think of that as being internal, don't we, really?
right.
You know, most of what's causing that, or maybe the entirety, is internally within the system, within the body, rather than external stimuli. But okay, yeah, interesting one.
Or both. I think so. I've read sometimes that an autoimmune issue sometimes is triggered by an outside element.
Mm-hmm. Oh, well, yeah, it could be. Sorry, the autoimmune response itself is obviously internal, but of course, the body, the person, the individual responds to environments or outside stimuli in different ways. And something, you and I could be in an accident and you sail through it, no problem at all. You go to work tomorrow. I'm at home upset and scared to go out, and my hair starts to fall. So yeah, it could well.
Right. It is fascinating. Are there any emerging technologies or treatments or anything that that you've seen for hair loss to treat or retain?
Nothing. Well, we've not really nothing at the moment. There's always something new, and it's always just tantalizingly out of reach, and it's always the next big thing, and then a lot of the time it disappears without a trace. If it's ever on the front of a media or a newspaper, I tend to disregard it, because you know that hair loss treatment did something to one mouse in China or something when you read the small print. There hasn't actually been a new general over-the-counter hair loss drug approved for about 20 years. And that's how far behind we are. Although there's constant research in the field, if we could understand even better the hair growth cycle, I think, and understand the mechanism that regulates it, we'd have greater understanding to develop pharmacological interventions. But at the moment, things we've already mentioned, laser light therapy, photobiomodulation, JAK inhibitors, PRP, they're all things, they've been around for a while, and they're helpful as part of an overall treatment plan. But I'll tell you what is exciting, and it's something I read about a good few years ago, but I think I can see this as a real possibility. In fact, it has been done recently for hair transplants, and it's the cloning of hair. So take a typical male with a lot of hair loss, the whole top area missing, the typical sides and back left. Now, they haven't got enough hair from the donor area to fill that entire top area. So the idea of hair cloning, taking a certain amount of hair, a certain small number, taking that off to a lab, growing it and multiplying it hundreds or thousands or tens of thousands of times, so you can give someone a full head of hair back, their own hair. And of course, it's important that it's their own hair so the body doesn't reject it. And that, I think, is a really exciting and real possibility. And it has been done, but it's just not out there in the mainstream yet. How long it will be, I don't know. But that's a really exciting one.
So when I had started my journey in this field over 20 years ago, they did say that was coming out in the next 5 or 6 years, which was, again, 15 or 20 years ago. But you've seen it done, or you've seen things on that?
I haven't seen it done. I've read recently about, the trials, the people who have had it done. So it's still, I believe, in trial. But the surgeons I know, we've all been talking about this for 5, 6, 7, 10 years. You know what it's like. You think it was 2 years ago and you realize it was 10. It's been going on for a while. But I think I can't see why it can't be done. I can't see why in time, and we're getting there. Obviously, the first few patients, when it first comes, it's probably going to be very expensive. But in time, costs could come down, the production could come down in production cost. Yeah, I think it's the future.
Yeah, that's exciting. So would you recommend anything now for people to maintain the health of their scalp while we're waiting for the cloning?
Well, yeah, that is important. Yeah, lots of things we've already spoken about. So general things that we know for diet, lifestyle, exercise, drinking water, good intake of protein, vitamin, minerals, balanced diet, supplementation where needed, not just buckshotting it everywhere, but finding out what we need, targeting the supplementation. If to maintain the health of scalp. So what we do with a lot of people who are actually considering or going, they're booked, they're going to have their hair transplant surgery, we still recommend topical solutions for them so that it maintains the health of the donor area, but also the new area, the hair where it's being transplanted into. We want that to be healthy. We want it to aid growth of the newly transplanted hair, not just this week, next week, but next year and decades to come. So topical solutions are always great when needed, when there's a need for them. Possibly even combining that with photobiomodulation, low-level laser light therapy. So the good ones for home use that have the right wavelength to get to where the cells are being produced just below the scalp. All of that. So it's an all-round approach from all angles, but targeted for specific needs and recommended by a professional in hair health care, not by someone you don't even know on Facebook or other social medias.
Right, because you don't want to cause the adverse effect.
No, that's right. We get so many people. I've been rubbing this oil. I mean, basically cooking oils and things. They're natural. Olive oil is natural, but don't rub it into your scalp. And I've been mixing it with this and putting that on. And it's like, no, please stop. Stop it now, today. You are banned. Things can do, I'm going to follow you home. I'm going to watch you. No, these can have adverse effects. It's like with coily hair. Years ago, coily, curled, textured hair, and people were putting a lot of oils on there to make it look shiny, to make it look softer. And yet now, rather a few decades ago, we started to discover that really what it was doing was coating the hair and stopping the hair from absorbing moisture from the atmosphere. And the hair is hygroscopic. It likes to have moisture in it. So by stopping that moisture going in, it was actually drying the hair out. And then people with that hair texture were going, my hair looks drier, I'll put more on. So it kept making it worse and worse and worse and worse. And when you actually say, you've got to stop this, it's like a secret addiction. Yeah, I'll tell you I'm going to stop it, but I'm not going to. It's like, please, how can we get through to you?
Right.
Yeah. Fortunately now, for the last decade or maybe longer, the coily, curly, textured hair, much more natural looks have been coming in for quite a long time. And I absolutely love it. I love to see these big curls just left to dry and sort of sit there naturally. I think it's beautiful. Everyone's got the right to do their hair how they want it, but I think it's lovely that we're accepting natural looks back in there, not trying to change it all the time.
I agree. I think that is the best. I mean, just seeing them have their natural hair is gorgeous. So you actually brought me to another question, is the chemical services on scalps. I see a lot of chemical burns, or people who have in the 80s gotten some of the perms. And I don't know if they did this in the UK, but in the United States, there was lye in the perms.
Yes.
And I'm seeing a lot of people, men and women, who have gotten those perms that I think, in my opinion, has burned the hair out.
It's yes, it's been a something that thankfully we're seeing less and less and less of it. And what we're seeing is historic. It's 20 years ago, 30 years ago, or more. There was a spell where mothers would be kind of doing this at home to their own children at a very, very young age. And it was a sort of believed cultural, almost indoctrinated thing that this is what we should be doing. And I don't blame anyone for doing that. But thankfully now we've come through the other end. And I don't see anyone doing it at all now. I'm sure people are, but we don't get anyone. I personally haven't met anyone in my clinic. I used to see people years ago at our Institute of Trichologists clinic in London, and we'd see people there. But again, it was historic. It was damage that was done 1-2 decades ago. But we're not seeing any new cases of it. Thank goodness for that.
Right. So in our clinic, I'm seeing a lot of women with hair loss and men who are almost coloring their hair too frequently. Our industry standard for hair coloring is 6 to 8 weeks. And I cannot tell you how many people that come in who color their hair and they say they color it every 4 weeks, 3 to 4 weeks, because they don't want to see the gray.
Right, yeah.
In my opinion, that's the first thing I say is you got to stop doing that, because I feel like it's burning the follicle out.
It might be. It would be, again, very difficult to comment generally. I think colors that are coloring white hair, so putting color into the hair, molecules of color, darker, mid-browns, etc., are going to be less of an issue. I'm more worried generally about the obsession that was of being the lightest, the brightest blonde you can possibly be, white blonde, silver blonde. So that we're actually putting bleach onto the hair, onto the scalp. Now, we could call it a hybrid color, we could call it a non-ammonia color, we could call it all sorts of things, but if it's got a peroxide level at a certain point, we are basically bleaching hair, and we're going to be causing some amount of damage to the scalp. And yeah, sure, if you're going to do that regularly, it's going to build up, it's going to be more and more damage. You could, I suppose, start to build up some kind of contact dermatitis there. And worst case scenario, if you're actually burning the scalp and getting almost 3rd-degree burns or blisters, then yeah, with blistering, you really, first thing you're going to be worried about, apart from the pain and the discomfort, is are we actually damaging the follicle to such an extent that hair growth isn't going to happen? Again, it's not something I'm seeing a lot of here now. It's not a daily occurrence, but if I go back a few years, we used to see a lot more of it.
We're a little behind over here. I'm trying to catch everybody up. But what it sounds like is taking care of your body, following directions, and seeking a professional's advice on hair loss.
Yes. It's you touched on it yourself right at the beginning of the conversation. It's a holistic approach. So, we're looking almost like a functional medicine where we're looking at how this connects to that and how that operates with that. Again, if we can do this not as a scattergun targeted, but lifestyle choices, overall health, dealing with health issues. If you're anemic, if you have a thyroid issue, get the right medication, get the right help for that. And then looking at topically applied medications, maybe oral medications as well. So a mixture of natural and good for you, and where it can help and where it can kick in and give really good results, then medication as well, not just diet and natural. Let's look at medication, weighing up the options. If there are some side effects, what are they? Am I prepared to go with that? but it's looking at the whole picture, the whole person and the whole condition, and coming together as a patient and the healthcare professional that they're seeing, coming together on an agreement on how to go forward.
And I think also giving it time, right? Because sometimes I don't think people recognize the change in their scalp for maybe 3 to 6 months.
I like to say 9. I say, because you know, if you say to people 3 months, you know they're going to be looking at it in a month and a half. If you say 6, they're going to be looking at it in 4 months. So I say 9 months down the road. If you want to come in and see me in 6 months, great. You know, obviously, if there's an emergency, phone me, come in and see me. But as a follow-up appointment, I'm looking 6, 9 months down the road. And at that 9-month period, I think that's the magic. That's when the magic really kicks in. When we can look with our scopes and we can see the difference, we can photograph it, record it, show the patient, but also when they're saying to us, I'm looking in the mirror, I can see a difference. Yeah. It's great. I love when somebody can't see the difference, but you can prove it to them in statistics. That's great. It gives them hope, and they're going to carry on doing what you're doing because you've shown them the results with figures. Look how much thicker each hair is in diameter. You only had 147 hairs in this area, this centimetre squared. Now you've got 20% more. That's great. But when they say to you, hey, Neil, I can see the difference just by looking in the mirror, that's great. And for me, the magic is at 9 months. But you know they're going to be looking at 6 if you tell them.
Right. I mean, I myself with clients, I'm parting their hair and looking for those little hairs parting up.
It's great, isn't it?
Sometimes you can see it, but patience.
Yeah, I do get very excited. I love it when someone comes and sits opposite me and I'm looking, going, I'm almost excited, jumping off my chair because I can see that their hair's, you know, I'm looking at the hair, I can see it fuller, I can see it standing up more, I can see the new hairs pushing the longer hair up and giving it body. And then I look at their face and I can see them starting to smile a little bit in the corners of their mouth because they're excited. And then when we take the figures, it's the topping on the cake. It's all, it's just great.
So rewarding.
But then, you know, what you were talking about earlier on, you know, for some cases, for some people, for some scarring conditions, you know, the diagnosis isn't good. And it can be very upsetting. But where we have some really good quality hair pieces that can be integrated into certain areas, like you say, totally life-changing. So there's options there. It may not be perfect. The only perfect head of hair is the hair growing out of your head. That's what you want. But hey, look in the mirror with this little piece that we've added. Look how great you look.
Right. Right. There's always some small compromises.
Yeah. Yeah, definitely.
That's worth all the effort.
Yes. Yeah. Do you know, I would prefer if we never saw anyone. If tomorrow, both you and I went, sat in our clinic and everyone cancelled because a miracle had happened overnight and everyone's hair was growing fantastic. That'd be great. You know, I don't want people to have hair or scalp issues. None of us do. But when they get them, thank goodness there's someone like you or I and the hundreds and hundreds of other trichologists, dermatologists, people that work with wigs and hair replacement and transplant surgeons and the whole gamma of people, all that are there to help and offer advice. Thank goodness that they are there.
I agree. And that's part of, I mean, that's the main reason why we're doing this series, is so that we can educate the people that are taking care of everybody who are getting their hair done, or even people that want to listen to it, just to have the knowledge and share that there's so many options out there and there's help. Definitely. Well, thank you very much for for joining me.
Oh, it's been a pleasure. Thanks for inviting me. It's been an absolute pleasure. I look forward to seeing all the interviews that you do. I'm going to watch every one of them.
Yes, we'll send them to you. And if you have any information of, joining your institute or anything that we can put on the series that we can share, that would be fantastic.
Definitely will do. Will
Thank
do. Thank you very much.
Yeah, thank you for joining me.
It's been an absolute pleasure. Lovely to meet you. Thank you.
You too. All right, have a good night.
Cheers. Bye-bye.